you know, when they're 18, which happens in high school a lot, people get access to cigarettes. So even if you're underage, you can have someone buy them for you pretty easily. How do you address that? How do you address the laws where we have tobacco label laws and things, but that doesn't stop it. There are still plenty of smoking commercials that encourage tobacco use. There are still plenty of labels that are hard to read and very small. And smoking still has a, you know, for many people, it has an appeal to it. So how do you address that appeal as well? And how you address it with teens, which is different than how you address it when you're 20 and you've just been smoking for so long. It's just, you smoke. It's what you do. So it varies greatly on that. You know, that on a policy level is something really, really hard to tackle, because that at some point you're taking that to the federal level. So maybe you're doing a bunch of these interpersonal to community level interventions that are leading up to trying to gather enough data to go to a federal policy level, because that's about the only point you can really influence the tobacco regulations, and even then that's a very tall order to do. But at the same time, you have to be able to prioritize and pick and choose your battles depending on the scope and capacity of your organization. You know, they're probably going to take one behavioral thing, which you then would break down even further into what makes that behavior and what are the risk factors associated with that, and how do you address those specifically. But this always reminds us that nothing is ever simple and nothing is ever standalone. Everything is impacted by everything else. So a comprehensive program is going to try to address, you know, the selective behavior, the environmental factor you want to hit. It's going to try and hit at least 3 or 4 of these levels, because that's probably really the only effective way of actually showing change in it. And that's why this is really important. You know, these models they're vague, and they only have so many, you know, you want to write it in this, and there's only so many spaces. If you have a specific focus, they're probably going to be more detailed to that focus, and also backed by a lot of data, community surveys, things like that. But they're almost endless in the number of possibilities that could actually go into here if you look into it far enough. So it is kind of about prioritizing what you can address given your situation and your resources. That's what we share. That's it.
Yeah.